Welcome to AUA Leadership in Business, an official podcast of the American Urological Association.
Welcome to the AUA Leadership and Business Podcast, where urologic professionals experience the practical application of business acumen essential for success in today's dynamic professional landscape. I am Dr. Micheal Darson, and in today's episode, we will discuss advocacy in urology. Why is it an elusive craft? We will journey through the last decade of AUA public policy work, acknowledging the explosive growth we have seen amongst urologists across the United States engaged in the national conversation of policy and regulation in urology. I'm excited to have a conversation with someone who many know as a driving force in the AUA Urologic Advocacy area. Immediate past chair, AUA Public Policy, Dr. Eugene Rhee from sunny San Diego, Southern California. Dr. Rhee concluded his 4-year stint as policy chair, and I'm eager to share with listeners his perspectives on advocacy work. Navigating healthcare policy and regulation in urology is today's topic. Dr. Rhee is the Regional Chief of Urology for Kaiser Permanente in Southern California and the National Chair of Urology for the Permanente Federation, responsible for empowering urologic care for 11.8 million lives within the largest nonprofit managed healthcare organization in the United States. He also serves as Area Assistant Medical Director for the Business Line and Finance for KP in San Diego. Dr. Rhee is the immediate past chair of the Public Policy Council for the American Urologic Association and serves as president-elect for the Western Section, AUA 2024. He was the 2013-2014 AUA Gallagher Health Policy Scholar. He is the past president of the California Urologic Association and the San Diego Urologic Society. He served as the inaugural section editor for health policy for urology practice. He served as the co-chair of the AUA Telemedicine Task Force, exploring the role of telemedicine in urologic care. He sits as chair of the Western Section Health Policy Committee. Dr. Rhee, welcome.
It was a real pleasure. And thank you, Mike. You and I have gone back many years in the trenches, and I'm so looking forward to our listeners hearing our conversation today. Thank you.
This is truly a podcast between two friends. So let's start with something listeners probably don't have an idea, and that's the governance structure of the AUA and public policy.
Yeah, I mean, I think the many of the listeners aren't really aware of just how extensive and big the AUA is. And really, I think before we start the conversation, there's a favorite quote I've used before from a Bangladesh poet, Rabindranath Tagore. And he said, "I slept and dreamt that life was joy, and I awoke and saw that life was service. I acted, and behold, service was joy." I think the AUA has really kind of illustrated for me and you that very reason that service to urologists is extreme joy for us. And I introduce the listeners to that quote because going to the governance structure of the AUA, it's run by folks like us in regards to on behalf of the members of the AUA, and so it's a stewardship, if you will, that we don't take lightly. The AUA today, just for those listeners, is one company with really 4 tax-exempt organizations. And so the AUA is comprised, as many understand, the national meeting is an example, is education and research. These are a 501c3, if you will, tax-exempt organization. Another part, a second part of the AUA is the really the public policy advocacy. That's another corporation of part of the AUA. The third is, as many are familiar, is the Urology Care Foundation. That's a third part of the AUA. And the fourth, which we'll talk about, is the AUA PAC, which is a 527 organization. That's a political action committee, if you will, that has a lot. That's where we do all of our political activities on a federal level, really dictated by the FEC, the Federal Election Committee, and bound by those federal laws. So those are really important. And why is that? Because really, I think it's wrapped around a mission statement that was founded in 1902 in Baltimore, right? And as a premier urologic association, and I encourage the listeners to see what the mission is about. It's basically promoting the highest standards of clinical care through education, research, and this is what's interesting: the formulation of healthcare policy. That's been around for years, and so that's what we're talking about today. And I think that is where our listeners, I think, are intrigued really about our work in policy and how they can be engaged and how they can connect in whatever way they feel as far as that's concerned.
It's interesting that you brought up the joy of advocacy. I always tell people that as I got more and more involved, actually the advocacy actually helped prevent burnout for me, because networking and joining together with colleagues on a common cause is really invigorating. And it's just something that I would highly encourage everybody to be involved in.
Yeah, no, absolutely. I think that it's interesting as we've reached out, Mike, to grow advocacy into the AUA. What I've understood is people have been really gladly involved in many ways, because it's rounded out really representing urology in their own practices. And there's been a growth strategy that we have really concentrated on during my 4-year tenure as public policy chair. And there are 5 pillars of growth, really. And these all reflect the intent of urologic providers. When I say providers, I mean it's also staff, nurses, and APPs and that sort of thing. But really, we've concentrated on the sections of the AUA. That's the first pillar. There are 8 sections of the AUA, and all sections proudly now have a really robust policy section that they concentrate on in each of the sections. We have specialty societies, right? Endourology, SUFU, Society of Urologic Oncology. These are just examples of those who have grown in policy work. Young urologists is a really exciting group that reflect, again, this sort of inherent want or need to really make a difference in terms of getting our voices heard for urologic care in the United States. Patient advocacy groups is the 4th pillar. That's really about engaging in a formal way public policy with folks in kidney cancer, bladder cancer, and prostate cancer. And then finally, our industry partners, which is really our 5th pillar, which is, how the industry partners work together to help on behalf of the patients and the urologic practices that they represent. These are really important things. And all this is a network, if you will. We call it a term, it's called interdependence. And the interdependence is the key, I think, to one voice, one action, making real headway into efforts when we talk about advocacy. So the policy success, I think, reflected over the past 4 years is really about the strong culture that the interdependence of these pillars have really been built and created, that have now become very successful. We'll talk about those successes as we kind of move forward.
Yeah, I think the interdependence, it's advocacy is what weaves it all together. I think
right.
That's an interesting way to think about it, but makes a lot of sense to me at least.
Yeah.
So healthcare policy is derived from strong culture of advocacy. Can you talk about that?
Yes. Legislative successes. It's. I think we're in the football season. We're right in the middle of it, and you can pop up folks like the 49ers, the Patriots, the Steelers. I mean, some are struggling seasons. I get it, but I mean, the point is that we recognize these teams, and it's the long game for many seasons that create what we call a dynasty, and the dynasty um, is important because it reflects sort of the legislative successes that we do are reflected by this team concept, this idea that, the quarterback is important, but the quarterback has the offensive line, right? That he or she relies on, and then the wide receivers, the cornerbacks, all that. Everybody has a role, and I think that that is reflective of sort of our team of advocacy in how this interdependence is really escalates our effects, if you will, as we kind of move with our priorities into folks like in DC or state capitals. I think the success in the long game, I think doctors, in reflection of the many years that you and I've been involved in the advocacy, um, the political process, and heading into November, November 5th, which is coming up, the presidential elections. I mean, the political process is chaotic. We basically uh, are not used to that as physicians, right? We have a scientific method. We have a hypothesis. We're designed to look at data, run the experiments, and then come to the conclusions. The problem in advocacy is that because of the chaos, change is hard to recognize unless you're unified in terms of this advocacy, a culture of advocacy. So it's not comfortable for our doctors, right? It's not in the old days. The AUA was just a research and education society. They weren't interested in going into DC, and that has all changed, right? And that's um, I got to give credit. Mark Edney, who is now the policy chair, he took over this previous spring. He coined the term the 3 Ps in advocacy, and the 3 Ps are process, policy, and politics. So the process is, again, the chaos, right? Is what is what is the public persuasion? What is it that we need to persuade in terms of uh, some legislative action, which is the policy, and wrapping all that in trying to create policy or change in policy. We can talk about different examples, for example, like PSA screening, but that's policy. But there's a lot of politics involved. And the politics is where doctors are really uncomfortable weaving through that chaos, if you will, to finally get to, well, how do we change the policy? And we can talk about that, in different examples. But that's really what that is all about.
Let's talk about advocacy as trained judgment.
Yeah. So, as a follow up to what we're talking about with the chaos is you have a sense about timing is what trained judgment is. We get this all the time, right? As physician leaders in our own practices, somebody may come to you with an idea, quote unquote, or usually it's a complaint, but you basically, they want change, right? And sometimes, my favorite answer is, the answer is not no, it's yes, but not now. um, Trained judgment is just that, is that there's a sense that you have a feel of the politics of an issue, you have a deep knowledge of it, and you really leverage the strong network that you have to really involve the key players in the field and create policy change. So in other words, this right time, if you will, in terms of the horizon, helps you with really achieving accomplishments, measuring those in reflection of what the success record has been And actually, and as an example for the listeners, I'm going to date myself here, but in 1974, remember when you actually had God, you remember that, Mike? You actually had a magazine that got mailed to you, and
I do.
so I used to have Time and Newsweek, and Newsweek's in 1974 they had Betty Ford, and all they labeled it was the operation, quote unquote. And what does that signify? That that was Betty Ford when she had a mastectomy, and mastectomy, people didn't even know what that that they didn't know what that is. And now the color pink, which you see on an NFL players, right? Immediately, men who watch, like for example, men who watch the football will look at pink and they associate it as breast cancer advocacy,
Right.
without any kind of prompting. And so that example shows you sort of this work that's the long game that we seek in things like prostate cancer, that require us to work in this idea of when's the right time, when do we pull the levers to initiate a network to get policy changes or creation on behalf of urologic practices.
Yeah, that Betty Ford cover, in many ways, was the first, at least to my knowledge, was the first, of a person sharing a very personal medical journey that is now done a lot on social media. So that kind of really kickstarted the educational process for a healthcare issue.
Right. Exactly.
And one of the things that you said that we'll go into a little bit in the next section is the knowledge of what the issue is. It's like you said, it starts with somebody coming to you with a complaint, which is really a request for change. And then you have to do a really deep dive into what the problem is, what causes the problem, what are the potential fixes, and then try to present that in a way, because when you go to the Hill, you're going to get asked questions. And if you don't know the subject in depth at a granular level, you're not going to be able to persuade anybody. Right. So.
Yeah. I mean, I think, well, it's funny, the when I first went, I was, you mentioned the Hill, and we'll talk about the summit because really that's the pinnacle of really what, the advocacy is, and you really it distills to the point where you realize you do and you can make a difference. Nobody's up there to talk about. I mean, you're the one who will need to talk to legislative aides and Congress folks, lawmakers, regulators about the voice of the patient and the voice of the doctors and the nurses and the staff and the conditions that you all are facing. And so I want the listeners to understand that the voice, of the AUA member, you're talking about complaints and pebbles in the shoe, if you will, or maybe even bigger, right? That causes burnout of things like prior authorization, step therapy. How does the voice of the AUA member get heard? And this is probably the most important thing I'd like the listeners to really absorb, that there is a process, a robust workflow process that occurs to get your voice heard. So let's just take, for example, your prior authorization. That's a big one. And you basically say, I've had enough of this. I've spent enough money, time, effort, my staff, my patients. So you get a survey, right? And the survey comes to you from the AUA, from public policy, and it's gathering input from members, societies, and urology. And basically, what it is it organizes federal and state priorities that are reviewed. The surveys are reviewed, and we basically are looking to distill, what are the ones that are bubbling up to the top. And, as an example, the pandemic was, obviously one of those that really came streaking to the top, along with telemedicine. That's a great example. But there's others, right? Reimbursement, medical liability reform, workforce issues, workforce shortages, right? We're seeing this in a real emergent fashion, even. But these are priorities that the survey gets helps us define what those priorities are. The committees in the AUA then to figure out by rank order what we're going to do for the year, and then we basically once we have that rank order, the AUA board has final approval of those priorities after some dialogue, and then we're moving forward. And where we move forward with that is obviously strategically on whether it's the political action committee work with the AUA PAC, or with going to the summit and everything in between. So it's really important for the AUA members to understand that the pinnacle of the annual event is the DC summit, but there's a lot of work throughout the year that we are involved in, whether it's regulatory or lawmaking in regards to these legislative priorities that are based on the voice of the member of the AUA.
Yeah, I would highly encourage our listeners, at some point in your career, at least make one trip to the summit, because it is a phenomenal experience. It really gives you an idea of how much work the AUA does on everyone's behalf, but you also get to see how the process plays out. It's very educational, and it's a great experience going to the Hill. I mean, it's phenomenal to have a real understanding of how the government works and how we can interact with them and influence change. So can you just do a kind of a short summary of like how the summit plays out?
Yeah, I mean, the summit, first off, it's a year planning based on the priorities that the AUA members have voiced. And from that become a strategic ask. So you had mentioned earlier, well, you need to have some details. So the summit is really where it is defined with many guest speakers, urology in the urology community, who are being asked, and they stem from societies, they stem from experts in the field, if you will, who bring up, supportive data on the legislative asks. It's very defined. We will you come in, in the first day, you get a primer as to like what's it like going to the Hill. How do you actually how do you present the asks to them? And throughout the the 3 days that we have, you're exposed to the different speakers in terms of how it's wrapped around those asks, where you become quite the expert. I might add, after being in the summit. But again, these are things of real passionate backing, because you will find out when you go prior authorization. Of course, that's going to be a big one, and your heart is behind it. And I think that is really why the attention, the appreciation for getting a lot more knowledge makes people very empowered, even way after the summit.
Talk about some of the successes of the summit.
Yeah, I mean, we talked about the long game. There's a short game and a long game. Some of the short game right now is, for example, right off the top of my head, is telemedicine right now. The public health emergency is concluding in December, and so there are hundreds of telemedicine bills now. Then the AUA, is aligned with many medical societies, including the AMA, with strategically supporting something like the Connect Act. And these are essentially bills that, number one, please approve telephone visits, right? Please approve parity in pay. The thing that we, as a theme, is you will cause the slow death of telemedicine if none of these things are addressed, right? Many folks, from the access point of view, in the remote areas and also socioeconomically distressed areas, cannot see a urologist and get to a urologist. So the phone is central in regards to getting this approved, as far as that's concerned, with CMS recognizing that. So that's a short-term objective for success. Long-term things like the sustained growth rate, the SGR that was killed. That, some of these are like the House of Medicine issues, not so much as the House of Urology. But we stand together with the House of Medicine to do those things that finally get killed in terms of impacting the physicians. The others are more operational, BCG shortages. Working with one company who essentially is in charge of manufacturing BCG on the private sector, and how we can aggressively work towards on the regulatory fashion and towards getting this addressing the shortage. The other one, another one example is again, we talk about prior authorization. So because urology has been so vocal and so very intentional about our work in burnout and the administrative burden, the data that we have on prior authorization, we were asked on a closed door session to privately attend and talk to the head of CMS, as well as the Surgeon General. Myself, there was a neurosurgeon, and also the president of the AMA. That was it in regards to this meeting. But soon after that were some prior authorization activity that came about from CMS to try to mitigate some of the things that we'd had expressed. But I think that those are kind of short-term successes. PSA screening is another one. Obviously, USPSTF back in the day, I think it was 2017. You and I were in the middle of all this when they made a grade D, which is do not recommend PSA screening. And the USPSTF is a U.S. Physicians Services Task Force. It's important because they're a body of epidemiologists that essentially define based on the data and make a recommendation. The problem with that is CMS lockstep and thus other private payers would follow with that, and that was a huge success to come back to the USPSTF over the year to change it to a grade C. By the way, there are new recommendations pending, but we are in a different place now in terms of our advocacy work, working very closely with them. So I'm eager to know. It's been confidential right now. It's not for public disclosure, so I don't know what the new recommendation will be, but we'll see. But these are kind of examples of successes in this space of urology.
Yeah, I think perhaps expanding on the telemedicine success is really important, because I don't know if our listeners completely remember some of the draconian requirements of telemedicine pre-pandemic, and like place of service and all the kind of requirements that really made telemedicine not useful. Then when those were lifted, the huge success of telemedicine reaching patients, the providers loved it, the patients loved it. When I was practicing in Arizona, we had patients that would drive 2 or 3 hours one way for a visit to go over their PSA results. And being able to do that was transformative for the patients and the providers. And if Congress doesn't act, then those draconian requirements that's what we're going to be left with. So it's a really significant issue. And I'm not trying to give any political advice, but you might want to find out how your legislators feel about the Connect Act, because it's really important for access to care, which is going to be a real problem coming up.
That's right. That's right. But I mean, it's really relying on us. There's no one else that's driving this conversation, right? And nothing's more effective than Mike Darson and Eugene Rhee and John Smith and Linda, uh, you know, can come together and basically go, we're talking on behalf of our patients as far as that's concerned. The AUA PAC, to better help understand for the listeners, the AUA PAC is a real important aspect to get our work, through the year by getting access to legislators. You have to be able to be in part of that process. This is the politics that we talked about, the 3 Ps. But in order to get into the process and change policy, the politics of this is how the U.S. government runs. And the U.S. government in the House the term is every 2 years, the Senate's every 4. But you basically are running the campaign, right? And so they're always looking for donations. So the PAC is really important. It's grown tremendously over the past 5 years, I must say, with many folks donating in urology, but we need more, right? So what you can do now, if you're not, if time is too valuable, we certainly, the AUAPAC.org is where you can get on and donate in regards to, as an individual donor, that goes to our strategic Congress folks for our advocacy efforts and priorities.
So, Dr. Rhee, where do we go from here as far as the workforce?
Yeah, I mean, I think that, we talked about interdependence, and the future relies on that to grow that. And to grow that, really to promote resiliency, and frankly, the joy in practice, to really protect that. I think that we as individuals have seen an erosion of that over time because of a lot of the administrative burden, the lower reimbursements, the pressures that we all see that really impact our relationship with our patients. And I think the future relies on the growth of the AUA PAC. That's real money. That's metrics. That drives the machine for us to be involved in the political process. I cannot tell you how important that is as we go forward in the future for our role in advocacy work. We talked about the growth pillars. There are 5 pillars, right? The sections of the AUA. If you are a leader in that section or an aspiring leader, I need you to be and continue to work the sections of the AUA on the policy side to really feature some of the state issues, the regional issues, and the federal issues on the sections. If you're a specialty society, if you are a urologic oncologist, know and understand that advocacy is about, robotic prostate, for example, where you're protecting the RVUs behind it. I mean, this is real issues. And surgical oncologists, urologic oncologists going to the Hill or testifying in front of, let's say, the AMA RUC committee. Those are kind of really important aspects of you as an expert protecting urologic care for our patients and our physicians. If you're a young urologist, the 3rd pillar, I think that if you're, there's so much for you to really, in terms of your curiosity, really define as to who you are as you kind of grow in urology, as to what your passion is and how you can kind of tailor that to what you just said, Mike, about how this helps my wellness, or, it gives me the joy in practice to really feel like I'm working on behalf of what I'm interested in terms of what's the type of patients. And speaking of patients, the patient advocacy groups, those patients who are prostate cancer survivors, bladder cancer survivors, kidney cancer. Those are the things that, from formal groups, how do we work together as one, to engage in terms of lawmakers and regulators with patients testifying and giving testimonies. And then finally, their industry partners. How do we actually, work together to enhance value in terms of the work they do, in terms of what their mission statement, in terms of the company, and how we can help to drive urologic technology innovation forward, and to protect that as we move forward for our patients. And finally, the other last thing I'll say is because I know we're hitting to the end, is workforce. I can think of nothing right now that's more in the future that is more concerning than what all urologists that I have had dialogue with, whether it's formally in meetings or informally, one-to-one, where we are seeing major shifts in our workforce, in how we address what we call the silver tsunami. The silver tsunami is really the demand really brought on by, obviously, the aging population. It has exploded. And where we go with that, who knows? What I mean by that is we're getting into the stage where there's a quote, right? Necessity is the mother of all invention. And from that, I think there are unique and innovative ways that urologists across the country are working, and working in ways that aren't traditional in the practice sense. I think there are different ways that they're finding balance to do urologic work. And it remains to be seen how that all pans out, but policy is front and center in regards to how we actually deliver that kind of care. And, the future is really about, for policy work, is to look at the winds of change, shift your sails, make sure that we don't drive into a hurricane without preparation. And finally, the definition of luck is where preparation meets opportunity. And I think that the opportunity is here for sure, right? The supply of urologists is small, but our demand is high. And I think that's the opportunity. So we need to prepare, and policy work is really how we prepare. We understand the shifts and the winds and change, and we can actually adjust the sails. So that being said, I think I hope the listeners really understood, get a really background of what we've kind of had a conversation with Mike over the years. I think I remember, at the summit, I showed a slide on Bishop Desmond Tutu, the late Desmond Tutu, and he said, "Don't raise your voice, improve your argument." And I think that rings true for us.
For sure. We've covered a lot of ground today. This has been great. Thank you so much for sharing your time and expertise with me and our listeners today.
It's a real pleasure. Thank you for allowing this format, and I hope the listeners take heed and we'll do something.
And thank you to our audience for joining us on the AUA Leadership and Business Podcast. Until next time, continue to learn, lead, and excel.
Thank you for joining us on the AUA Leadership and Business Podcast. We hope you found today's insights valuable. Remember, growth is a continuous process. To further enhance your business acumen and accelerate your professional development, we invite you to check out the AUA Institute for Leadership and Business track on demand. Featuring 9 courses covering a wide range of leadership and business topics, the ILB track on demand will empower you to lead effectively and achieve your professional goals. Invest in your future and register today at auanet.org/ILB track. That's auanet.org/ILB TRACK. Until next time, continue to learn, lead, and excel.